We did initially have two presenters for this talk. Unfortunately, Joe Cashmore is unable to attend last minute due to an injury, but we do have Shana Ahmed here today. So Shana works for Wildlife Health Australia as a project officer in the Wildlife Disease Surveillance Program. She graduated from the University of Adelaide with a Bachelor of Animal Science and completed postgraduate studies in conservation biology at Macquarie University. Shana has worked in South Australia and New South Wales in a variety of fields, including ecotourism, bush regeneration, and environmental education. She has spent 3 years working in the wildlife rescue and rehabilitation industry and hopes to continue championing the work of wildlife volunteers and professionals to make a positive impact on wildlife health in Australia.
All right, good morning, everyone. Thanks to the organisers for having me here today and for you all coming along to listen. So as Dean said, my name is Shana and I'm a project officer with Wildlife Health Australia in the Disease Surveillance Program. So today I'm here to talk about Wildlife Health Australia, what we do, our role in the wildlife health community, and what resources we have available for wildlife rehabilitators. Before I get started, I'd like to firstly acknowledge the traditional custodians on the land we are meeting on today, the Whadjuk people of the Noongar Nation. I pay my respects to their elders past and present, and I extend that respect to all elders past and present on the land in which we conduct our work. Okay, so to start off with, I'm actually going to ask for a show of hands. And who here has heard of Wildlife Health Australia? You can raise your hand. Okay, that's actually a pretty decent number of you in this room. So there'll be some people here that know us quite well and interact with us a lot. Some of you may have heard of us, but not really know all that much about what we do. And there will be some people, I've actually already spoken to a couple this morning, that have never heard of us before. So the University of Sydney conducted a study. It's yet to be released, but they surveyed rehabbers and they asked them, have you heard of Wildlife Health Australia? And over 60% of those surveyed said no, that they hadn't. So I'm here today to try and remedy that. So Wildlife Health Australia, or WHA, is the national coordinating body for wildlife health in Australia. We are a non-government agency, non-government organisation with the aim of facilitating and strengthening communication and relationships between wildlife health stakeholders. To do this, we work with a network of over 800 national and international stakeholders, and we are also responsible for coordinating Australia's general wildlife health surveillance system. Our aim is to protect and enhance the health of the natural environment, the health of Australia's wildlife, and its people under a One Health framework. So throughout this presentation, I'm going to walk through some of our operations, our role in the wildlife health community, and demonstrate what WHA has to offer rehabilitators in terms of information, guidance, and connection. So we want to start a conversation on how we can best work with you for the common goal of improved wildlife health. So as everyone in this room will know, the wildlife health sector is made up of many, many moving parts. So from prevention and preparedness in emergency response to research, policymakers, and of course, rescue and rehabilitation. WHA's role within this is coordination across all of these components. So by working with our partners and stakeholders, our aim is to make sure the right people are in the room getting the right information that they need for the best outcomes for wildlife health. So we want to hear about how your extensive species knowledge and local knowledge can best work together with the rest of the health network to protect and enhance wildlife in Australia. So to help illustrate the role that WHA plays across these components, I'm going to give a very topical example at the moment that is highly pathogenic avian influenza, HPAI, sometimes known as bird flu. So Australia remains one of the few countries in the world that is still unaffected by HPAI, but it has caused ongoing outbreaks in North and South America, Europe, Asia, and Africa. And the mortalities have been seen not just in birds, but also in mammals. So these two maps here illustrate how the global distribution of avian influenza has evolved, from the left, which is October 21 to September 22, to the right, which is from October 22 to May of this year. So while HPAI is not currently in Australia, it's still an extremely significant disease for us to think about due to the potential impacts an outbreak would have to livestock, the environment, human health, and of course, wildlife health. So as the national coordinating body for wildlife health, where do we come into this equation? So this flowchart here shows the potential entry of HPAI into the country through internationally migratory wild birds, and how it could then spread to 3 areas of concern: wildlife health, the poultry industry, and human health. Each green section on this chart is a critical control point for us to be able to detect the disease early and therefore enable action early. So by working with our partners, Wildlife Health Australia collaborates, coordinates, and networks at each one of these critical control points. So whether it's a wildlife rehabilitator who contacts us because they're concerned they've seen signs of avian influenza in wild birds, or through our contacts with public health or industry stakeholders, we work together to make sure the right people are talking to each other, and we believe that wildlife rehabilitators are important to this process. So Wildlife Health Australia operates nationally, and there are several ways that we achieve and coordinate this. So this map here shows each of the universities, zoos, and vet clinics that form part of our Sentinel surveillance program. So the vet clinics have a high wildlife caseload, for example, WA Wildlife, or they help us to expand the geographical reach of our surveillance system, for example, the Kimberley Vet Centre in far northern WA. So combined, these hospitals see more than 61,000 free-ranging wildlife cases per year. They help us to improve the linkages between the hospitals and government agencies, and they really become our eyes and ears on the ground for wildlife disease. They can also contribute cases to the national database that I'll discuss in a few slides' time. Another key part of this national system are the Wildlife Health Australia coordinators. So the WHA coordinators are the primary contact point for wildlife health matters in each state. They are appointed by the Chief Veterinary Officer for their respective state or territory, and there's also one for the Australian Antarctic Division. The coordinators report disease events and can initiate or coordinate disease investigations. They form part of the coordinators group that meets quarterly in a teleconference that is chaired by Wildlife Health Australia. And this group also includes other important representatives, for example, fisheries, forestry, and the Registry for Wildlife Health. The coordinator is supported by an environmental rep, so they represent their respective state's environment agency. So for example, here in WA, the Department of Biodiversity, Conservation and Attractions is the state's environment rep. So now I'm going to do a brief background on some of the key WHA programs and projects and how they might relate to wildlife rehabilitators. So starting with the surveillance program, I've already mentioned the Sentinel surveillance program and the Wildlife Health Australia coordinators. We also have the Bat Health Focus Group and the National Avian Influenza in Wild Birds Steering Group. So each of these groups also meet for teleconferences that are chaired by Wildlife Health Australia, and that enables information sharing across the country with a broad range of stakeholders. So for example, in our Bat Health Focus Group, we have government representatives, university, wildlife rehabilitation groups, public health reps, ecologists, vets, and the Australian Speleological Federation. So they represent people involved in caving. So all of these groups and people are in some capacity involved with bats in Australia. And as the governing body, WHA can bring all of those people together to talk, plan, and share information. And that helps us to create a really collaborative approach to disease surveillance. The WHA surveillance programs incorporate both general and targeted surveillance. And we also take contributions from other areas. So importantly for this audience, that can also include wildlife rehabilitators. So one of the reasons we want to start this discussion with wildlife rehabbers is that we feel your first-hand experience with wildlife on the ground can be important to the reach and capacity of our surveillance program. So disease incidents or investigations are entered into the national database by the surveillance coordinators or the WHA coordinators. The database is called EWIS, which stands for Electronic Wildlife Health Information System. This holds a record of wildlife health investigations that have occurred starting in the 1980s. WHA administers, analyses, and moderates this data to ensure it's as accurate as possible and so can be utilised if needed. Our next program is the Emergencies Program. So this program has been established to develop WHA as a trusted, active and key national advisor for wildlife within Australia's emergency system. So we work to identify wildlife health issues, trends, priorities and risks for when a wildlife emergency occurs or for when a wildlife health perspective is required for effective emergency management. So WHA does not provide boots on the ground during an emergency, but rather we utilise our network to provide accurate information and intelligence before, during and after an emergency incident, taking an all hazards approach. And finally, I'll mention our One Health program. So One Health is the principle that the health of humans is closely connected to the health of the environment and animal health. And at WHA, we take a One Health approach in all of our activities. So that would include any potential work with wildlife rehabilitators as well. So through our One Health program, WHA was recently appointed as a collaborating centre for wildlife health risk management by the World Organisation for Animal Health earlier this year. This newly established International Wildlife Collaborating Centre aims to incorporate wildlife health into One Health decision-making throughout the Indo-Pacific region. So moving on from what we do, I now want to discuss what we believe we can offer wildlife rehabilitators. And we've split this into three key areas, being information, guidance, and connection. So starting with information, as an information resource, WHA creates and is involved in a wide variety of free publications. For example, we administer a catalogue of over 140 fact sheets on specific areas of wildlife health across multiple species. And these are a free resource that can be accessed on our website. We also create and contribute to a range of wildlife health relevant publications. So up on the screen now is one example, the ABLV Australian Bat Lyssavirus Bat Stats publication. So we release this every 6 months and it reports on lyssavirus infections in bats around the country. Our monthly newsletter contains new publications on diseases and wildlife issues and national and international news on wildlife health events. You can receive this newsletter by signing up to become a member with us. We also contribute wildlife data and provide a wildlife health perspective to other publications, for example, Animal Health Surveillance Quarterly by Animal Health Australia. And lastly, there is of course our website, which is continually being updated with guidelines, biosecurity information, and the latest information on wildlife health events. So next up is guidance. So the guidance we can provide can be from the WHA team ourselves or from the resources that we have available. So WHA comprises of a diverse team of wildlife professionals with wide-ranging experiences in areas such as veterinary medicine, international environmental policy, conservation biology, and rescue and rehabilitation, just to name a few. So by utilising this collective understanding of the wildlife health sector, we were able to advise on wildlife health matters and support coordination efforts in response to wildlife health events. So the catalogue of fact sheets that I previously mentioned are continually being updated and supported by the most up-to-date science and reviewed by leading experts in the field. So the fact sheets are developed in a response to a range of wildlife health events, including disease events and natural disasters. So for example, there are two on the screen now. One of these fact sheets, supplying water and food for free living wildlife after natural disasters. This is just one example of an easily accessible form of guidance for rehabilitators in an emergency situation that you can trust has been updated and is being reviewed constantly. And thirdly, connection. So myself and some other members of the WHA team have worked in wildlife rescue and rehab for many years between us, and we understand the disconnection that rehabilitators can feel from the rest of the wildlife health system. With our network, we believe we can provide further connection for rehabbers into this system. And our goal of being here today at this conference and going forward is to start a conversation on how we can work together to make that connection for rehabilitators as strong as possible and continue to build and strengthen the wildlife health community. So to really emphasise why we believe wildlife rehabbers being connected into the wildlife health system is beneficial, I'm going to talk through an example of a successful disease investigation that was brought about by rehabbers right here in WA. This may look familiar to some people. I'm sure there'll be some audience members that were involved in this incident. So between July 2019 and January 2021, 53 Quenda were admitted to the Darling Range Wildlife Shelter with what appeared to be sarcoptic mange. So that means during this time period, just under 30% of all the Quenda had sarcoptic mange. So the rehabilitators at the Darling Range Wildlife Shelter knew that this was something unusual for them to see, and it was reported to the WHA coordinator and the environment rep, and this then led to the involvement of one of our surveillance partners, Murdoch University. Once this happened, a case definition was developed utilising data that had been collected by the wildlife rehabilitators. Word of the outbreak was spread to other rehab groups and ecologists in the area. A roundtable discussion was held that brought together key stakeholders in the incident. And last year, a paper was published that for the first time characterised sarcoptic mange in Quenda. And the lead author of that paper, Leah Botten, was actually also a rehabilitator at the Darling Range Wildlife Shelter. So what this example shows us is that wildlife rehabbers know their environment, they know their animals, and they can therefore identify when something unusual is happening. So that's really valuable for disease surveillance and for the wildlife health system overall. And that, when combined with the network of WHA, we believe can lead to some really positive outcomes for wildlife, just as it did in this particular incident. So finally, to finish up the presentation, I want to discuss what sort of events to report and how to report. So on this slide are the types of events that are typically reported to us by vets or the WHA coordinators or our surveillance partners, and they can be entered into the eWIS national database. If you do come across any incident of this nature, so for example, if we think of the Quenda situation, you repeatedly see symptoms in a species that you really feel and know are unusual, we do encourage you to reach out for further guidance, information, to talk to your vet and to report it. It's worth noting as well that anything reported to WHA will be kept on file and managed under our confidentiality principles. So even if it doesn't trigger a larger investigation at the time, we will keep a record of it in case it becomes more significant later on. And finally, how to report. So as I said, we encourage any rehabber that experiences something that really raises a red flag to reach out. It might not seem that significant at the time, but what you might not know is another rehabber might have reported the same thing, or one of our surveillance partners, such as maybe one of the vet clinics, has also seen something similar. And once we have all of those people that are on the ground, hands-on with the wildlife, reporting the concerning or emerging things that they see, that's when the dots can start being connected. And that's why we think the wildlife health system will really benefit from rehabbers participating in a more active way. So to report, you can talk to your vet, call the Emergency Animal Disease Hotline, and you can also visit our website for contact details of the WHA coordinators. So finally, as someone that worked in wildlife rescue and rehabilitation for several years, I have to admit that I hadn't heard of WHA before I applied for a job here. Personally, I really wish that I had. So the resources, information available, and the networking opportunities are second to none. And I highly encourage you to visit our website, sign up to become a member, which is free. And if you're here at the conference, please do come have a chat with us at the trade table just outside. We're also doing a book giveaway. So if you sign up to become a member, you can nominate your local vet clinic and we'll select 10 vets, randomly select 10 vets to receive a veterinary medicine textbook. And for those that aren't here physically, that are listening online, we also welcome any comments, ideas, suggestions. You can email us using our contact details on the website. And that brings to an end my presentation. Thank you to all for listening and for the conference organisers for putting this on. And if there are any questions, I've got loads of time actually, so bring them on.
Thanks, Shana. Yes, we do have a bit of time. And what we might do then for our Zoom attendees, if you could just put a message out on the Q&A, obviously they can hear as well. We might take 2 questions from our Zoom colleagues. Would anyone here in the audience, we might start off with a few questions in here first while our Zoom friends have a chance to have a bit of a think. Have any questions for Shana who would like to come up? Yeah, come through.
I noticed you're talking about reporting poisonings, and sort of what sort of area of that are you looking at? So we get like secondary poisonings with the raptors and things like that. What are you interested in a way in that nature?
I wouldn't say there's a specific type of poisoning that we're interested in. It's just poisoning is definitely, it can be hard to prove, but it is something that we would be interested in including into the database. I think the reason why we have talked to your vet as still one of the main ones there is that some, we still need that sort of diagnosis to come from the vet. But if you're seeing, multiple dead animals, even if you suspect poisoning, it doesn't matter if it's secondary or whatever, we definitely still want you to reach out and look into that further.
On that, I might just
Yeah.
have a question too. So a lot of rehabilitators work with vet clinics, and not
Yep.
all vet clinics might necessarily be quizzed up on how to get in touch with WHA. Are there any easy fact sheets on WHA website that rehabilitators can either print out and give to their vets, or forms that they can just go, here, can you fill this in and send it off for us?
There's not so much a form to fill out. We do have some just sort of promotional material on the tray table outside, just as a sort of FYI of who we are. That would probably be something good to give to your vet clinics, just so they're aware of what we are. I think the issue that we're sort of finding is that a lot of rehabbers and vets just don't sort of realise that there is this framework in place for these sorts of things. And yes, it does obviously vary vet to vet in terms of what they're capable of doing. There are a few vets you might have recognised on the map I showed at the beginning of the presentation that are in our Sentinel surveillance program, but there will be other vets as well that will reach out to us. We do also have, if a vet is interested in doing more diagnostics, but they aren't able to do it themselves, we do have some funding as well for vets to do additional diagnostics. There are criteria to be met, of course, but if you have a close working relationship with a vet, it would be great if you could tell them who we are. Yep.
There's probably coming up and trying to run a mic around anyway. If you want to run the mic, just squeeze it a tad, that'd be awesome.
Can you hear me? Yeah. I was wondering, is it able to get notifications on maybe new things coming? I work in triage, and it'd be really helpful if there was something I need to look out for, especially if it's communicable, to basically flag it as soon as it comes in, so we're not like waiting around in the hospital. The vets are finally seeing it. It's maybe gone to a ward and stuff is getting passed around. I was just wondering if it was a notification.
So do you mean a notification to us, sort of, or
to us? So like you get reported, there's been an outbreak of a weird thing, be aware. But for us to know, like basically as soon as possible, just to catch it, so we don't.
So on our website we do have a sort of hot topics section, and that if there is something that we are concerned about, we would definitely put it on up there. Also the newsletter, I'll just plug again, if you sign up to be a member, you'll get the newsletter, and that will also include anything emerging that we're a bit concerned about.
Okay. Anna, do we have any Zoom questions? Yes, I emailed it to me. I don't have my phone. Yeah, first time ever. The suspense. Read through 49,000 unread emails. Okay, we just have the one question, and it is, what do you consider multiple deaths?
So for us, we usually say around 3, which I know for some people might seem a little low, but 1 is 1, 2 might be a coincidence, but 3 is when you might start getting a bit interested. 3 might still be a coincidence, but I'd say if you're sort of seeing, 3 dead animals that have all died in the same spot around the same time, that would be something to maybe take to the vet, look into that further.
Cool. Well, if we don't have any more questions in the room, we do. No worries. But if you would like to come and ask your question while I load the online question. And then we might wrap it up after that, just because we are nice and ahead of schedule today, so we'll keep that moving. So thanks, Shana, for keeping it.
I've just got a question about those quendas. Did you actually treat them, and if so, how? Or did they get sent off to someone to get treated?
I don't know. Maybe there is someone here from Darling Range Wildlife Shelter that might be better able to answer that. Oh, there is? Yeah, I believe they did successfully treat and rehabilitate some. Yes, come on up, please. Because I just was reporting this as an admirer. I wasn't involved in it directly myself.
Hello. Yeah, so we've had hundreds of them come in the last few years still. So we've done a lot of trapping. We've done a bit of treatments in the field of really like populations that have been really sick, but only just a tiny bit of mange. But the ones that have actually come into the shelter, we've been treating mostly with moxidectin. So either injectable or topical. We've found that's been the best treatment for it. And also lots of fluids. And we've used 100% vitamin E oil on their fur or their skin. You'll have to excuse me, I've got a bit of a... Anyway, yeah, so the vitamin E oil has been fantastic for when they first come in. We've found that it's soothed their skin and also they've been less itchy. And then from there, we've used QV oil, but mostly the moxidectin weekly for up to 7 weeks. So it's a really long time to keep them in care. Yeah. So
Thanks for that.
yeah, we've released a lot. Thank you.
For you, if that's okay. and then we'll let you go. No, thanks, Yaz, for that information. That was really helpful. Thank you. What diseases or incidents are you the most concerned about at the moment?
I don't want to use the word concern because that might sound a bit negative, but we are doing a lot of work in the HPAI space at the moment. So that's something that's definitely on the forefront of our minds. So a lot of reviewing, reviewing processes and all of that. We're updating our outreach materials as well. So that's something that's a work in progress and more to happen there. But I'd say that's probably the one that comes up the most in our meetings at the moment.
We do have a little gift for you and Joe. Please pass this on to Joe. Sorry he couldn't be here today. And great having a wildlife rehabilitator involved in these groups. I think that's the strategy. We've all got to infiltrate